이제부터 영어로. 네, 이제부터 영어로. So, Happy New Year, Dr.
Yeah. Happy New Year.
Thank you very much. So, for today, it's not that cold, isn't it? But last week, it was quite cold, and also a week before the last week, also it was quite freezed. That's why both of us got cold last week, and we are nearly recovered. So, so we've got only 1 minute, and if you have any questions, please leave your message as a message. Leave your question as a message. And for today, because Dr. Yeo is here in Seoul together like us, and so I'm with Dr. Yeo today. 대략 한 1분 정도. 하고 시작을 하고 Hello everyone, I think it's nearly time to start. So, hello everyone, welcome to the second JC's monthly webinar. Yay! So before the beginning, Happy New Year to everyone. We hope all the best luck for you, as always. I'm with Dr. Eun-chul Yeo today, from Korea now, and he's our speaker today. The topic is based on the published cover article of Laser in Surgery and Medicine. If you have any questions, just like as before, during the presentation, please leave it as a message. Please welcome Dr. Yeo.
Hello everybody, Happy New Year. I caught a cold and I'm sorry my voice has changed. My topic today is about the article published in Lasers in Surgery and Medicine last year, November. And the title is Evaluation of Novel Device High-Intensity Focused Ultrasound with a Contact Cooling for Subcutaneous Fat Reduction. So what's new in this device? I mean the LIPOcel. It is equipped with contact cooling and it is verified by the peers. It is a novel device. It's something new. And I myself was the author of the article. And I cooperated with Sugan Lee. He's a developer in JC's company and also affiliated with Jeju National University. And the famous Professor Sung-won Jang in Assam Medical Center, one of the biggest hospitals in Korea. And we published our research in this journal. I will just follow the list of the content published in the article. What's new? I will do the introduction about the novel HIFU with contact cooling, and we did the animal study, and we did the visual observation of the surface of the mini pig, and we measured the surface temperature, and we took biopsy, and we sent the sample to Assam Medical Center, and she did the histological assessment, and she also did the human study, the case series. The first, novel HIFU system with contact cooling. LIPOsonic, as you know, is the first device which is aiming to reduce the fat volume in the body. As you can see here, this is the handpiece equipped with the sonic transducer inside in the water. Liposonic company regards their standard protocol is sufficient enough to reduce the fat volume in the body. The standard protocol means, 60 joule per square centimeter, 2 pass. And the limitation of intensity, if you increase the intensity, you can get more effectiveness, but with the limitation of pain and ecchymosis, the intensity is limited. And they think this is enough procedure. But from the JC's point of view, we regard liposonic like this. We need more effectiveness with one procedure, one session. Even some doctors use 60 joule per square centimeter, 3 passes, site repetition, but it is more painful. The patient cannot endure this kind of pain. So they put the patient under sedation or anesthesia. This means to get some meaningful effectiveness with liposonic, the situation is uncomfortable. So the LIPOcel from JC's added the cooling device into the handpiece of the sonic transducer. This handpiece is full of cool water at the temperature of 5 degrees Celsius, and the temperature is maintained at exactly the same 5 degrees Celsius all the time of the procedure. This is the big difference between the previous HIFU and the LIPOcel of JC's. So if we simply summarize the function of the LIPOcel from JC's, with the cooling device, pain is tolerable during the procedure even with high fluence and with the stacking. With the preservation by cooling the surface, we can ensure the protection of the surface. There is no ecchymosis. And in a practical fluence, we can expect acute and chronic process of lipolysis. This is very important idea, and I will mention about acute and chronic process of lipolysis later in my presentation. And look at the standard protocol, 95 to 130, much higher than the other device. 2 pass, site repetition. Even with the cooling device, there is some pain sense. So pain is the limitation of the intensity increasement. But with the practical fluence with the tolerable pain, within this range, the LIPOcel guarantees no pain, fat loss. Now we did the animal study, and I did a visual observation of the surface of the mini pig. This is mini pig skin. 90 joule. Actually, the unit is incorrect. 90 joule per square centimeter, 80, 70, lower than that, 60 joule per square centimeter. Without cooling and with cooling, you can observe the ecchymosis in all the 4 areas treated with non-cooling device. But with the LIPOcel treatment, you cannot see any ecchymosis. It's a big difference. Even with stacking with the LIPOcel, this means 3 times stacking at the same site, we cannot observe any ecchymosis here. So LIPOcel with cooling aid, we cannot see any ecchymosis. In the histology of the treatment, this is unpublished data, not published in the article, but we have examined the tissue from the pig after liposonic mimic treatment and the LIPOcel with the contact cooling treatment from JC's. We don't see any extravasation of red blood cells in the tissue, but we can see many red blood cells extravasated in the tissue. This is clinically implies the ecchymosis in the surface. So with the contact cooling, we couldn't see any ecchymosis on the surface. Next one, we measured the surface temperature of the mini pig skin. Exactly printed in the article, figure 1b, measure the temperature of the surface with no cooling and cooling. With no cooling, acting like liposonic, you can measure the temperature around 44 degrees Celsius or 41 degrees Celsius according to the intensity of the treatment. But with the cooling treatment, with LIPOcel treatment, the highest temperature was 37, even with 90 joules per square centimeter. So the temperature of the cooled area was below 40 degrees Celsius. It guaranteed the safe treatment on the surface. This is also unpublished data. The stacking, the temperature was measured from the center of the bed tissue, I mean 1.3 centimeter below the skin surface. It measured the raised temperature of the bed tissue. With one pulse, it was 63 degrees Celsius. With two stacking, it surged up to 76. With a 3 site repetition, 3 stacking treatment, it raised up to 88 degrees Celsius. So over 70 or 75, we can expect some coagulation necrosis, rupture of the cell membrane of the fat cells. If we go backward, this is the temperature of the surface. It's around 30 degrees Celsius. So it is safe. When you deliver the 3 stacking without cooling, it's over 40 degrees Celsius. It is dangerous. But with the cooling protection of the surface, we can maintain the surface temperature in safe range, but we can raise up the core temperature up to LIPOcel rupture temperature. It's very effective. And we took biopsy and sent the samples to the Asa Medical Center. These are the results from the histologic review. If you see these 4 different indexed, lipomembrane change, some inflammation in the cell membrane, it is highest in the first week and subsides in 4 weeks. Comparison between cooling and non-cooling treatment, this inflammatory process subsided faster in cooling device. It took more time with no cooling. But when you compare the effectiveness means microlobular change in the fat cells, rupture of the cell membranes, is roughly the same between the cooling and non-cooling devices. So with this one figure, we can assume LIPOcel with cooling can have the similar efficacy with LIPOsonic, faster recovery from the inflammation that could be related with less side effect. It's more beneficial to use the cooling equipment. And from now on, I'm going to do the comparison between non-cooled area versus this one. Both sides was treated with LIPOsonic mimicking device with a non-cooling device. You can see some erosion here by the blister formation from the surface temperature elevation after treatment with LIPOsonic. 100 joule per square centimeter, 3 pass. It is much higher than their standard protocol. If you deliver very high fluence, you can have some blister, erosion, and scab, and sometimes scar. With 80 joule per square centimeter, 2 passes, you can see the extravasation of red blood cells. That means ecchymosis, severe ecchymosis in clinical setting. So with non-cooling device, there could be some side effect with high fluence. From now on, I'm going to compare both sides, the cooled treated area, the area treated with non-cooled device. I can tell you the effectiveness is very similar. After comparison, we can get the impression the acute injury after HIFU treatment is common to both treatment. But what a surprise! I didn't expect this kind of membrane rupture after HIFU treatment. Because I have read many documents from LIPOcel research and I found nothing like this. They always say no change immediately after HIFU treatment. But with this LIPOcel treatment, we could see significant immediate change. And we also could see we have used 100 joules per centimeter 2 passes. This is much higher than the LIPOcel standard protocol, and this was possible with the cooling equipment in LIPOcel. After 4 weeks, 1 month later, we could observe some inflammatory cells in the fat tissue area, including some giant cells engulfing the broken lipids and cell debris. Inflammatory cell infiltration with lipid-laden macrophages. We could see in both sides, commonly inflammation in 4 weeks after HIFU treatment. And after 3 months, 12 weeks after treatment, we could see reduction in fat tissue in LIPOcel treated area and LIPOcel mimicking device treated area. The effectiveness was much similar in both treatment sites. We did another special staining using Mason's trichrome staining. With this comparison in the cooled area, non-cooled area, it was very similar. We could find smaller cluster of adipocyte. The cluster has smaller size, and we could find the thickened fibrous septa in the fat tissue area. And we did toluidine blue staining. Toluidine blue stained the lipid in the tissue. Control sample without treatment, we could see well-defined round-shaped fat cells in the fat tissue layer. After treatment, with LIPOcel treatment, we can see small size of adipocytes compared to control site and thickened fibrous tissues in the fat tissue area. It is roughly the same to the area treated with non-cooled device, for example, LIPOcel. The change in the fat tissue is much similar. In both sides, the diameter of the adipocytes decreased after HIFU treatment, 4 weeks after. So we can expect 1 month later some volume reduction in fat tissue and smaller size of adipocytes. And we have seen fibrous septa is thickened. That means clinically tightening and lifting of the area. Another experiment using electron microscopic image of adipocytes 4 weeks after HIFU treatment. Before treatment in the control, well-shaped round droplet inside the fat cells. It is known that the space is filled with one droplet, one big size droplet in the fat cell adipocyte. After treatment, in both sides, we could see some small lipid droplet in the periphery of the lipocyte is common to both sides. I believe this could be the sign of previously destroyed fat tissue, including the destroyed fat droplets and cell debris. It was common to both sides. And Dr. Zhang did the human study in Assam Medical Center. She did 3 people's treatment, aged 38, 28, 33, all female. She used 100 joules per centimeter 2 passes, 111 to 130 2 pass, 95 to 100 2 pass, according to the tolerability of the patient. The patient says a lot of pain. There was the limit of the intensity of the treatment. And then she found 1.5 centimeter reduction in circumference of the waist, 2 cm reduction, 5.5 cm reduction in circumference in the waist, and in terms of volume reduction is around 100 cubic centimeter. Before treatment in different view, 4 weeks after treatment. And in the CT scan of the abdominal area, in the level of the umbilicus, shows some reduction. I cannot precisely diagnose the CT image, but after request to the radiologic department, they reported it is about 100 cubic centimeter volume reduction after one treatment. Here are some unpublished images from my colleague hematologist. After 2 months, you can see here very dramatic improvement in the patient. If you treat many patients, sometimes you will encounter this kind of dramatic change in some of your patients. And after getting this image, I called him back and I told him that it's typographical error. 2 weeks after must be 2 months after. But he replied back, this is correct time. So what a surprise. After 2 weeks, can you even imagine, immediately after 2 weeks, can you imagine this kind of significant improvement in a very short time? And he replied the same way. What a surprise, but he really experienced this kind of patient. So this is clinical implication that the LIPOcel can induce very acute injury in the fat cell and very rapid response in some patients, where the acute injury is a dominant mechanism in that patient. And after finishing to report our observation, we did some discussion. I'm not satisfied with my corresponder's discussion. I wish we could include this acute versus chronic injury in the fat layer. If I had been the corresponder, I would have included the discussion about acute versus chronic injury of the fat tissue, because it is related to LIPOcel treatment mechanism, and I think it is very important aspect of lipolysis. First of all, I will introduce the publication afforded by liposonic users. This is published data, and they compared low fluence versus high fluence. Low fluence means in their experiment 126 joule per square centimeter. High fluence meant 133. This is small difference, and they found no statistically significant difference, and their conclusion was higher fluence was not required to get sufficient effect. Low fluence 126 is efficient. This is their result and conclusion. 126 means 60 joule per square centimeter, 2 passes is their standard protocol. I think this experiment was designed to add some evidence that their standard protocol is enough, but my point of view is different. What about 200 joule per square centimeter? If we can use much higher fluence, we can get much difference from low fluence. It is possible with the liposonic, LIPOcel, with the aid of the cooling device. We have used 100 joule per square centimeter, 2 passes. It is equivalent to 200 joule per square centimeter. And from their publication, I could see the image of the histology after HIFU treatment. You can follow the description. Histology of adipocytes after treatment with a low energy ultrasonic device. Adipocytes are still intact. This means no acute change here with the liposonic treatment. This is exactly contrary to our experience. I did LIPOcel treatment and I found acute injury in the fat tissue. This acute injury wasn't found in their standard treatment, but here is some hint about high-fluence treatment. According to Figure 4, histology of adipocytes after treatment with high-intensity focused ultrasound disrupted the cells. Here are some examples of disrupted cells. They already showed some hint about when you increase the intensity, we can get some acute injury in the fat tissue. That could be related to more efficacy with HIFU treatment. After doing my own experiment, I have found immediately after treatment, denatured collagen bundles and disrupted adipocytes in the acute injury samples. It was quite a surprise, but it is evident. And thinking about the influence of our treatment with the aid of the cooling, it was 100 joules per square centimeter, 2 passes, much higher than the LIPOsonic. So rationally thinking, I think this is possible with the LIPOcel treatment. And 4 weeks after, we could see the inflammatory cell infiltration. And finally, 3 months after, we could see fibrous safety, thickening, and shrinkage of the fat tissue. These are the result of the LIPOcel treatment. And I assume LIPOcel is working through the acute injury and through the chronic injury together, making more effectiveness compared to other HIFU treatment. Finally, this is my assumption. Chronic injury-mediated lipolysis, I first encountered this terminology when I read about the report of cryolipolysis. All these descriptions, immediately after treatment, not visible change, but 14 days after, you can see inflammatory cell infiltration. Some of them are lipid-laden macrophages. This is description about the process of lipolysis after cryolipolysis. And exactly the same phenomenon is observed in the publication of LIPOsonic treatment. So I believe LIPOsonic treatment is mediated by chronic injury-mediated lipolysis. Officially, company LIPOsonic doesn't tell us it is mediated by chronic injury, but rational thinking leads me LIPOsonic is mediated by chronic injury. And there are many reports about acute injury-mediated destruction of the fat layer, including interstitial laser treatment. But what I've read in the article was just observation immediately after laser treatment. And in the histology, they showed only ruptured adipocytes. That's all. I was wondering whether 14 days after laser treatment, what will happen to the tissue? Can I find the inflammatory cell or some lipid debris? So I did myself the experiment using the interstitial laser and published it under the title 3 months follow-up observation of the tissue after interstitial laser lipolysis. In the publication, I reported ruptured adipocyte immediately after laser treatment. 14 days after, this is very important. The tissue with disrupted cell membranes was squeezed and the lipid was squeezed out in 2 weeks. The liberated triglyceride from the fat cells was already has entered the systemic circulation within 14 days, and there was scant inflammatory cells. I could hardly see any lipid-laden macrophages. This means the fat was absorbed, not much inflammatory cells. These are processes of acute injury made by interstitial laser treatment and ultra and ultra shape. So what's the mechanism of LIPOcel treatment in the fat tissue? As I explained in the whole presentation time, I have observed ruptured adipocyte in the histology, and 14 days after, we have seen rather dense inflammatory cell infiltration and lipid-laden macrophages. So this means LIPOcel is mediated by acute and chronic lipolysis. There is implication that this could be more effective than any other HIFU devices. Thank you for your attention.
Thank you very much. So, thank you very much, Dr. Yao. And now we are ready to collect the questions. So please leave your questions, or if you are able, please raise your hand if you are able to ask your questions. And while we're waiting for your questions, and I actually, during your presentation, Dr. Yao, and I've got a question for now, just a few of them. So after the destroyed vessel, so now I wonder that where do the lysed vessels go?
It's a very important issue. First of all, lysed vessels leaves the cell debris and fat droplet.
Yes.
Fat droplet is absorbed through the lymphatic system
Yes.
to the systemic circulation.
Yes.
Maybe the cell debris of the vessels will be engulfed by the macrophages infiltrating that tissue and will be removed later.
Yeah.
Mainly, we are cautious about the fate of the lysed fat, not the lysed fat cells.
Yeah.
I mean, the lysed fat is actually the triglyceride is lysed to free fatty acid and glycerol.
Yes.
So in this case, it is actually not lysed fat; it is destroyed fat.
Okay.
So we have liberated from the vessel into the interstitial tissue.
Yeah.
We have liberated triglyceride.
Oh,
So the exact question is,
yes.
What is the fate of liberated triglyceride droplet into the tissue? The TG is absorbed through the systemic circulation through the lymphatic system and enters the heart and pulmonary artery and through the capillaries of the lung, where the TG is raised to free fatty acid and glycerol. The free fatty acid is toxic to the tissue. There is some subclinical information there. We call them subclinical pneumonitis.
Subclinical pneumonitis. Yes.
And free fatty acid is bound to albumin there and go through the blood circulation, enters the liver finally. Yes. And then after entering the liver, it is incorporated into the metabolism of the dietary fat. I mean, it is incorporated into the lipid carrier protein.
I see. So it sounds like quite related with, so after the LIPOcel treatment, and which means it sounds like it's the same status when I eat a lot.
Right.
So after
some time, it is incorporated to dietary fat metabolism. Yeah. So even though you didn't eat much food, you have additional calorie intake from internal side.
I see. So exactly, if I get the LIPOcel treatment, then which means because my triglycerides are exposed to my internal body's condition, so that's what then my status then, it will be a status even I didn't eat anything, but it seems it is same status like as I eat a lot.
Right.
I see.
You have surplus of calorie intake.
I
So
see.
you have to reduce the diet.
Yeah. Oh, I see. So I'm doing my question, and I got some questions from any person, and her message is: we have treated a client with strange of eight, and she felt much pain in her ribs after. Why is that? Oh, you mean you treat your client, you give the treatment with level 8 perhaps, and she felt much pain in her ribs after. Yes, you mean. So yes, level 8, actually I can answer that for you, because level 8 means it's 95 joule. Everyone has their patient level, their pain level is very variable, isn't it?
Right.
Aren't they? So,
and the level 8 in the LIPOcel
yes,
could be
it's
related with the pain sense
yes, I
according
guess
to the
so.
patient tolerability.
Yeah.
So I mean the level 8 of LIPOcel anytime could elicit pain in the patient, but the pain in the lip is the bone.
Yeah.
So maybe the pain around the rib.
Yes.
And usually when we are dealing with fat reduction in the abdominal area, when we move the treatment under the rib cage, where the thickness of the fat layer is thinner than the around the umbilicus area, we frequently see some pain in this area because there is less tissue and less buffer for transport of the heat generated by the device, so it's more susceptible to elicit pain in this rib cage area.
Oh, see. Okay. Okay, and now I think there is another question from Dr. Sarakoglu. Some of my LIPOcel treated patients told that they experienced oily stool after the treatment week. Oily stool.
Okay, I don't believe this procedure is related to oily stool. Maybe the patient had diet pill while she was on the treatment. As I mentioned, the calorie intake from rice to fat from inside is surplus to dietary fat. So there is additional calorie intake, not through the intestinal system. So if you don't spend the calorie, the surplus calorie will be deposited in the fat tissue again. So to have better efficacy, we need to restrict the dietary intake. Then we need the aid of the dietary pill, especially the surplus calorie intake from the inside of your body, from the fat tissue, doesn't make inflation in the dietary alimentary system. There is no hunger. Still you feel the hunger sensation even with high intake of calorie through the inside of your body. So you need to suppress the appetite. So the patient might have taken the dietary pill to reduce the fat intake. That may be related with oily fat. I strongly believe the treatment of the fat tissue and absorption of triglyceride through the systemic absorption doesn't have any change in the dietary habit.
I see. Okay. And now the next question from Karen Hill. Has anyone not responded to the treatment? Has anyone not responded to the treatment? If so, why was that? And what should you do?
In any procedure in dermatology, I believe there are some patients who doesn't show any response to the treatment. We call them non-responder. Definitely in this treatment, there is some proportion of patients who shows no response.
Oh.
Then we need to change to another modality of treatment.
Yeah,
or we can consider more aggressive treatment and more repeated session of treatment. Even the patient doesn't show any effect after one treatment, after repeated session, the patient may show some effectiveness.
Oh, yeah. And actually...
And I can see...
Yes.
Okay, this is a very important issue. I told you the calorie intake from inside. If you rise the fat and if you don't suck them out, it is absorbed to the body and incorporate to the dietary fat metabolism. That means you have dietary food intake, calorie intake, plus surplus intake from the LIPOcel treatment.
Yeah.
And the calorie was not burnt up. It will be stored in the fat tissue. So after treatment, the patient's dietary and exercise habit is exactly the same. There will be some surplus of calorie and it will be deposited again.
Yeah, it will be deposited.
So there will be no effect. So to accelerate the efficacy, to get more effectiveness after one treatment, we need dietary intake restriction. That portion should be supplied with the absorbed fat from inside. And we should do the exercise.
We should do the exercise.
To spend the last fat, I mean the free fatty acid.
Free fatty acid.
Usually, it's very hard to burn the stored fat.
Yeah.
We remember that with low grade, very long time exercise, you can finally get access to stored fat.
Yes.
And we can lyse the fat.
Yeah.
We lyse the fat means we use the hormone sensitive lipase. By the aid action of the lipase, the triglyceride is dissolved to free fatty acid and glycerol. And free fatty acid is absorbed to the body.
Yes.
In this case, after hormone sensitive lipase action, lipolysis, is very hard to achieve. But if it occurs, I mean, when the fat cells start to lyse the stored fat, the fatty acid is liberated to the systemic circulation in bound form with albumin. Then glucose and fatty acid has free competition. So you can use fatty acid. But in normal situation, before using the fatty acid, it takes time. But with the procedure after LIPOcel, there are a lot of fatty acid available in the body system, readily to be used by the muscle. At this moment, we have to use the free fatty acid. By this post-treatment precaution, we can really reduce the fat volume. So maybe if the patient didn't have any precaution after treatment, maintaining the same habit, same intake of diet, no exercise, there might be no effect after treatment.
I see. So your recommendation is, in theoretically and academically as well, so after the LIPOcel treatment, because it is not, we sucked out the fat itself, so because it is not non-invasive device system, so which means the free circulated fatty acid, triglyceride somehow, and which is fat actually. So we need to, after the treatment, immediately after the treatment, we need to do something. The patient needs to just burn up something or burning up the calories. Thank you. I think it's very good comment. Thank you very much. So next question is next questions. Let's see. What is the main differences between a freezing method and HIFU?
Okay, freezing method, cryolipolysis.
Yeah, cryolipolysis.
I told you it is mediated by chronic injury.
Yeah.
So it takes time before you see some improvement. With the HIFU, for example, the liposonic, I told you it is mediated by very similar process.
Yeah.
But LIPOcel is something different.
Yeah.
It is mediated by acute and chronic injury together.
Yes.
So sometimes you can see very rapid response in the patient in 2 weeks.
Even in 2 weeks.
Even
yeah.
in 2 weeks.
Yes.
And additional in chronic mediated
Efficacy.
So it is the difference.
That's a huge difference. Okay, thank you very much. And
practically cryolipolysis,
yes,
you cannot do the procedure every day. You have to deliver the whole amount of intensity in 1 day. With the LIPOcel, you can do small amount of treatment every day.
Oh, that's true. Yeah.
So you can modify your protocol if you are using the HIFU treatment.
Oh, I see. That's very good for the patient as well. It is very good.
And the HIFU treatment can be tailor-made. If the patient has some bump here, it can be tailored to this small area.
Yeah.
And you can see the change in the process of lipolysis in the long time.
Okay.
And you can focus more protruded area. But cryolipolysis, you cannot do this kind of measure. You have to put the pad in 1 day.
Yes.
And you have to wait 2 or 3 months. You cannot predict exactly the consequences. But with LIPOcel treatment, you can just contour, shape. You can shape your patient. Yeah,
shaping and contouring. Actually, that's the contour. It sounds like it is real contouring. And I think we need to figure it out because it's nearly time to be end. So I think that's the last question. Can you compare with ultra shape procedure? Well, actually, from Organ Garso, and actually that procedure is mostly likely because our next webinar, luckily and also he is also ours as a faculty member from Malaysia, Dr. Ungku Sharin will share his experience with LIPOcel. It's a case experience from him. So I think your answer would be more better for him because he is one of the other guru like as Dr. Ya, and he's going to be he's more better for you to give the answer.
Okay, but theoretically and from the science space, ultrashape uses 250 kilohertz. LIPOcel 2 megahertz. So low frequency and mediated by mechanical injury rather than temperature elevation.
I see.
LIPOcel is targeting to increase the temperature of the tissue. Ultrashape is targeting to make some mechanical injury in the tissue.
I see.
Ultrashape is mediated by acute mechanical injury. LIPOcel is mediated by acute and chronic thermal injury mediated process. And I've used ultrashape for some time, many years ago. I've used the first prototype, and I found very limited efficacy after treatment. So LIPOcel has more effectiveness compared to ultrashape.
I see. So for now, and I think it's time for wrap it up. Yes, wrap it up now. So again, thank you for your review, all the dramatic article. I love this concept. So everyone, and if you do not attend here, and we will share with you through the follow-up link. And also for the next webinar, and I already mentioned before, it's going to be 9th of the February, and the detail of the webinar will be announced again through the email. So for now, we are going to finish now. So again, thank you very much, Dr. Yap. And thank you everyone for participating, and I'm looking forward to meeting you everyone next time.
Thank you everybody.
Thank you. Bye.
We're going to meet at ALSA meeting in the March.
Oh yes, that's very important. So Bye.
Bye-bye.
Bye.